What's up, outliers? Welcome to Performance Bites for bite sized insights into complex subjects in health and performance. Today, we're going to go over different types of injuries. So, if you participate in sports, it's likely you've maybe experienced one of these injuries because that is kind of a part of the game when we go out and we ask our bodies to do things, or we make contact with others, or we make contact with the ground. So, to kind of start into this, we need to kind of understand a couple components of anatomy just to clear up some of the things that might be a little bit confusing as we go through different types of injuries. So, we all kind of understand what bones are. Obviously, structurally, they hold us where we are. They give us our basically internal structure. There's 206 of them in our body. Then we have our muscles, which is there's a lot of freaking muscles in the body, but we have about 400 to 500, depending upon who you're talking to, because we can break down all the little itty bitty muscles in our hands. But we'll say that there's a lot of them. And then we have tendons, and this is what's really important to understand. So, tendons are a connection from muscle to bone. So, the best way to remember this as we go through is the most common tendon in the body that people are familiar with is going to be the Achilles tendon, which attaches your gastrocnemius muscle and your soleus muscle to your calcaneus in your heel. So, that is a muscle to bone connection. So, tendons, muscles to bone. Now, ligaments are a bone to bone connection. ACL is a very popular ligament that's in the knee. So that ligament is connecting the femur to the tibia. So a bone to bone connection. And it's important to understand this because the first injuries that we're going to go over essentially are muscular strains. So, muscular strains are going to be an injury to the muscle itself and or to the tendon that is going to cause basically a rip or a tear. Now, there's grades to this. There's basically a grade 1, which is a mild, grade 2, which is obviously a little bit worse, and then grade 3, which is pretty severe and usually results in a complete rupture of the muscle or tendon, which is going to disconnect. And we like to say fruit roll up, which that's a very kind of gross image, but that is what it happens because there's a lot of tension in muscles. And so when there is a complete rupture of it, they tend to kind of go upwards and call that a fruit roll up because with people when they tear their Achilles, which is unfortunately a very common injury for men 30 of age and plus, yeah, that kind of goes up and into the calf, and that's a whole thing. So the biggest thing is that grade 1 can be basically micro tears. So, example of that would be actually what happened to me just this past weekend out racing motocross. I had to stamp my leg out because my rear end washed a little bit in a corner, blah, blah, blah. Anyways, it was a very mild strain, some micro tears to the tissue, which obviously caused discomfort, caused me to lose a little bit of function in that tissue, but it didn't displace anything, didn't cause any bruising as far as I could see. Maybe there's some internal bruising because there is some remodeling that's going to happen. And anytime we tear something, capillaries also will tear and that will leak blood. But as far as I was concerned, I can look at my leg. Everything's pretty good with that. It took about a week or two to heal, feeling pretty good with it. But if it was a grade 2 tear, which would have been a little bit more of like a partial tear. So if we looked at it like this is the whole muscle, and I'm making an image with my hand here, and this chunk, 1/4 of it tore, that would be a partial tear. So that's going to be that grade 2. It's a little bit more severe, likely going to see a lot of bleeding internally, which is going to look more like a bruise that can dry into a hematoma, which is going to basically be like this internal scab that happens. So that can be healed through rest and recovery, but obviously is going to take much more time and can be severe enough that it does actually need to be worked on surgically to reattach the area. It just kind of depends on the magnitude of that grade 2. Now, grade 3, as I said, that is a complete rupture. That's definitely going to require some work via surgery to get reattached and actually bring that back to its origin or insertion point. So, how this kind of works is it's going to take a lot of time to recover from a muscle strain. You almost maybe would rather break a bone, depending upon the type of bone break, but we'll get into that as well. So, as I mentioned with my own injury that I just had, with the grade 1, that was likely due to an eccentric, load that was a little bit too much for the tissue to withstand. So, I basically kept myself from falling down when I was at high speeds on a 230-pound motorcycle, blah, 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 blah. Makes a lot of sense that it would have been a eccentric, uh, forceful stop rather than concentric overcoming a force. So, obviously, stretching is gonna be the thing that tears a muscle. Muscle typically actually, not typically, is not gonna tear when it's going into a shortening state. That makes no sense. So if we look at it like a rubber band, even though the muscles aren't like a rubber band, but if I wanted to tear a rubber band, I wouldn't put it in its shortened state. I would pull apart on it to create rips in its fiber. So muscles are only gonna tear when they're going basically in a elongated state. In the healing process, this is pretty cool because the first thing that's gonna happen is the inflammatory response, which is going to basically send these things of neutrophils and macrophages in to basically clean up dead debris. So it's going to get all that bad stuff out. And that's going to be about the like first 5 days or so. So we're going to see a big inflammatory response. And this is where a lot of people kind of get confused with injuries because inflammation in the body is actually a response of cytokines, which are a positive thing because that's telling basically the body that it needs to send nutrients, it needs to send healing things like new cells to the area to help remodel what has happened. Now, when we go in with things like NSAIDs, which are non-steroidal anti-inflammatories, call it ibuprofen, we go in with those and we remove that inflammation, we're actually causing a prolonged healing response because the body kind of knows what it's doing. It's pretty damn smart. So when we trick it by putting in a medication or over icing an area and removing that inflammation, that's going to create less of a healing response, which like an old outdated thing that is now known not to actually be the best thing is RICE, which is rest, ice, compression, elevate. So, yeah, you can do those things for the sake of comfort. I will add that in that if you use that RICE method, say you injure something and it hurts and you use that RICE method, you'll likely actually get a little bit of a pain reduction. Same with using the ibuprofen. However, just know that you actually are slowing down that healing response that the body naturally is going to undergo by sending a lot of inflammation to the area. So that's going to be like in the first 5 days. So if you can't withstand it, I'm not going to tell you not to do that, but it's good to understand how the body is basically cleaning out an area and trying to help it heal. The next phase is going to be essentially the repair and regeneration phase. So that's going to be about the first 3 weeks or so after those first 5 days. We're going to get new cells in the area, which those are going to be our stem cells that we naturally produce, satellite cells. Those are going to be really helpful for basically remodeling and also bringing in things like fibroblasts, which lay down a type 3 collagen, which then will eventually convert to a type 1 collagen, which is going to have a better structure, be stronger, and actually help to remodel the area so that everything can be reconnected. And that collagen coming in is actually what's going to create new scar tissue, which is going to be great because we need to basically bring, point A to point B again if we have a tear, especially if it's above a grade 1 into grade 2 or, even worse, a grade 3 tear. And those things need to reconnect. Now, something that's important to understand about scar tissue or these collagen fibers, they don't have an orientation of direction. So when they're coming in, you can think of it like they're laying down spider webs. It's kind of flowing in every direction. There's no, north and south because the tissue of muscle has a direction and a pination that it wants to go. So when that scar tissue comes in, it's going to basically just like slap itself on. Think of it like the, spider web or even just like a chunk of, like, putty, just bam, just right on there. So when that scar tissue is forming, it's very common that a lot of tightness will occur essentially. And that's where some people will be like, oh, I just want to stretch this area. It feels so tight. It feels so tight. And I always say, like, for the first like 3 to 5 weeks, at least until you're like in the remodeling phase, probably a good idea not to like focus too much on stretching the area, especially if you have a tear, because of the fact of the body is actually trying to remodel and create scar tissue, and once that scar tissue has formed, everything will start to grow underneath it and create the direction that you want. Then You can go in there and do soft tissue work, stretching, all that sort of stuff to basically clean out the fibers of scar tissue that are running in the wrong direction and recreate new motor patterns that are going to actually flow in the direction that the muscle is going to flow. But like I said, that takes some time. That takes over a month to do, and people can be a little bit impatient. But most of the time, it's going to be of that like 4 6 weeks time until stretching is going to be a little bit more appropriate. However, it does depend on the magnitude of the injury in itself to kind of do that, which that's where you kind of have to feel things out, understand how, your body's responding. And everybody also heals at different rates. I'm a pretty fast healer, but I also work with a lot of people that aren't very fast healers. So these are just like averages in time. It doesn't mean that it's like the perfect diagnostic of time for the injuries, of course.